Bismillahirrahmanirrahim. Today my topic of presentation is health system frameworks. You have to fight through some bad days to earn the best days of your life. Learning objectives of today's presentation is health system introduction, objectives, health system function, major systemic challenges in healthcare setting, model of care which include biomedical model of care, organization model, health system framework introduction, WHO building block framework, International Health Partnership Monitoring and Evaluation Framework, the WHO flagship program control knob framework, recent advances and MCQs. Learning outcome. By the end of this presentation, participant will be able to describe the health system introduction, objectives, function, model of care, health system framework, WHO building block framework, IHP monitoring and evaluation framework, the World Bank flagship program control knob framework. What is the health system? Health system include all the institution, people and action whose primary purpose is to improve the health. The basic objective of health system is to improve people's health and well-being, responding to people's expectations, providing protection against the cost of ill health. The functions of a health system include the governance, financing, generation of resources, and service delivery. Health system has actually the three independent outcome-oriented objectives, which include health utility, process utility, and financial fairness. Health utility consists of two further goals, which include achievement of average level of health and equitable distribution of health, which means to give the health according to the need, not equality, but according to equity distribution of health. In process utility, it is derived from interaction between people and the health system, how people are treated by the health system, and utility obtained from living under institutions, which include how allocative and redistributive decisions are taken. It includes process utility, for example, willingness to pay approach is most common applied approach in process utility, which include allocative and redistributive decisions and the interactions between people and health system and how they are treated. Health system is third is the fairly financed. The health system is fairly financed if the ratio of total health system contribution of each household household contribution of each household through all payment mechanism to that household capacity to pay is identical for all households, irrespective of the status and use of health system of household. It includes two key challenges. First, household should not pay an excessive share of their income for health care or being impoverished population. Second, wealthy household should contribute more than poor household, reflecting vertical equity and element of progressivity. Therefore, healthcare system is constructed for three reasons on the basis of objectives. First, the system maintains the health of the community. It also provides services to the sick and also wounded. Additionally, it helps curb the cost of expensive medical bills. This ties to the development of conceptual framework of four level of healthcare system, which include patient level, then patient interact with care team, which is frontline healthcare workers, for example, healthcare professional, family members, and others. Then organization, which include infrastructure, resources, it include hospitals, clinic, nurses, and beds or homes, and environment, which include regulatory environment, market, and policy framework. For example, public and private regulators, insurers, healthcare purchasers, and research funders. Therefore, four level of healthcare system. The healthcare system also has some major systemic challenges in coming some few decades. And first of most major challenges in developing country is the fragmentation of health services. These include actually the coexistence of subsystem with different modalities of financing, affiliation, and healthcare delivery, each of them specializing in different strata of the population according to their type of employment, income level, ability to pay, and social status. Fragmentation of health services related to coexistence of several units of facilities that are not integrated into single network or services at different levels of care that are not coordinated among themselves. And it care defines the healthcare delivery that does not cover the entire range of promotion, prevention, care, rehabilitation, and palliative care services and services that don't continue over time. Although, if the entire range of services are present, for example, promotive, preventive, and rehabilitation, palliative services, but these are not integrated into single network at different levels. Therefore, that leads to fragmentation of health services, which is major problem in developing countries. It also includes poor performance, barriers to access, poor quality, irrational, inefficient use of drugs, high cost of health services, and low satisfaction among patients. We can address the fragmentation of care through new model of healthcare and different health system frameworks and fragmentation of services, new ways of organizing and managing healthcare services. Therefore, universal access to health and universal health coverage. Here, universal access include absence of geographical, economic, socio-cultural, organization, and gender barriers that prevent all people from making equitable use of comprehensive healthcare services. Whereas universal coverage is sufficient organizational mechanism and financing to cover the entire population. Universal coverage in itself is not sufficient to ensure health, well-being, and equity in health. Therefore, four simultaneous and interdependent strategic lines are therefore given, which include equitable access to health services, increasing financing with equity and efficiency, strengthening intersectoral coordination to sustainable development of health, and strengthening stewardship and governance. Because it really does not make sense to provide excellent care in clinics and hospitals if people are to return into conditions that make them ill in the first place. Therefore, model of care is actually thought, which is a logical framework that defines what services will be provided to address the health need, demands, and expectation of people. Therefore, it come under organizational model, which is presented, which is a structural organization and resources required for delivering of services in response to those in need, demands, and expectations of people. These health system functions and model of care interlink. The health system function include governance and stewardship, financing and resource generation, and therefore model of care, therefore interlink, which include health services, for example, organization and management, services and benefits. These are interlinked. Transitioning, there is transitioning model of care from few decades, for example, from biomedical model to primary healthcare based model. Biomedical model take health as privilege, a commodity or act of compassion, whereas primary healthcare consider it as a human right, equity, and solidarity. Biomedical model basically focus on patient, and primary healthcare focus on people, families, or communities. Governance include doctor patient include multiple involvement of leadership. Financing include payment to provider fee for services of profit oriented, whereas primary healthcare universal health coverage, social protection. Provision of services acute, episodic, and curative in biomedical care, whereas in primary comprehensive and social services. Developmental resources include physician, nurses, and other professions, and it includes wide range of professions and competencies. System approach, it is linear in biomedical and it is complex adaptive approach in primary healthcare system. The biomedical model of care is actually centered on acute episodic care, supply driven and organized by level that fragment care, hospital based and dependent on costly technologies, provision of curative services through fragmented process of care, lack of continuity, poor quality and safety, inefficient referral system, generates of exclusion and dissatisfaction among patients. The biomedical model of care and radar phenomena that the patient shows up, then patient is treated, patient is discharged, and patient vanish. Whereas people-centered model of care in distinctive element include people-centered, it is integrated, comprehensive care, continuous, and it include life course approach, which is the organizational model, and which is the structural organization and resources that is required for delivering of services in response to those demand and needs and expectation of the community people. Therefore, fragmentation of healthcare delivery system and include various intermingling, which include traditional medicines, private practice, non-profit organizations, other providers, universities, social securities, and other vertical and horizontal programs, for example, HIV or AIDS, malaria, and others, maternal and child health care program. Therefore, what pushes the need to change? Changes in demand, for example, demographic, epidemiology, people expectation, changes in offer, for example, knowledge and technology, workforce issues, financial pressure. Social changes include globalization, reforms of state and source sectoral reforms, all act and pushes the need to change in health services. Therefore, we need integrated health service delivery network, which is a network of organization that provides make arrangement to provide equitable, comprehensive, integrated, and continuous health services to defined population and willingness to be held accountable for all for its clinical and economic outcome and health status of population served. Therefore, for this purpose, the various health system framework is organized and presented, which is actually a support structure system that holds parts together, has something stretched over it, and act as a main structure. It is used to describe, explore, and analyze health system. Healthcare system achieve more equitable and sustained improvement across health services and health outcome by using the various healthcare system framework. Health system framework and building block. The WHO handbook covers all components of health system or deal with various monitoring and evaluation framework. It is structured around WHO framework that describe health system in terms of six components, include six building block framework. Six, service delivery, health workforce, health information system, access to essential medicine, financial and leadership and governance, which is figure shown. Six building blocks: service delivery, health workforce, health information system, access to essential medicine, financing, leadership, and governance. And this include two goals and objectives: assess coverage and quality and safety. It includes overall goals, outcome, improved health level, include level and equity, responsiveness, social and financial risk protection, and improved efficiency. This is six building block leads to strengthening of health system in different ways. Some cross-cutting component include six leadership, health information system, provide basis for overall policy and regulation of all health system. Building block key input component to health system include specific financing and health workforce. A third group include medical products and technologies and service delivery reflect the immediate output of health system. Inevitably, any type of division of complex construct such as health system is fraught with problem. This is also true for framework which focus on health sector action and underplays the importance of action in other sectors. Therefore, this six building block does not take into account action that influence people's behavior both in promoting and protecting people and use of healthcare service. This framework six building block does not address the underlying social and economic determinants of health such as gender inequalities or education and does not deal with substantial dynamic links and interaction that exist in each component. On the other hand, focusing on these separate components helps put boundaries around this complex construct and permits the identification of the indicator and measurement strategy for monitoring progress. Therefore, strength include that all health systems have multiple goals. Thinking health system require consideration of horizontal management and support functions as well as services and programs. Whereas weakness include no sense of interaction among six building block, no explicit recognition of people and relationship within and across block, citizen and users are absent because local health system is made up of many actors which include the local services from ministries, local government health district management teams, NGO, civil societies, district hospitals, faith-based health centers, profit for private profit organization, public health centers, traditional and political religious healer, community leaders, household individuals, and it is implementation of role. For example, district health management team include 10 essential function: diagnostic investigation of health problem, policy and development plan, resource management, healthcare delivery, regulation, operational research, quality, healthcare delivery, partner mobilization, monitoring and evaluation, coordination and supervision. Therefore, a local health system is a system of intents, process, outputs, and impact. Intent include legal and regulatory frameworks, directive norms, standard policies, and resources include ICT equipment, drugs, and funds. And processes include institutional arrangement, informational flow management, platform of management, fora management processes, and output include healthcare delivery system, impact include assess quality, efficiency, and service use. Therefore, which is absent in six building block, there another framework is presented. It launched in 2007, which is launched by International Health Partnership related IHP, aim to better harmonize donor funding commitments and improvement the way in which international agencies, donors, and developing countries work together. This IHP has developed a common monitoring and evaluation framework to enable targeted monitoring and evaluation of health system. This framework is country focused and supportive. The monitoring and valuation framework include input and output processes that reflected in outcomes and impact. The added value of this framework is that it brings together indicators and data sources across the research chain its entirety. For example, input processes, output leads to impact. Therefore, addressing monitoring valuation for different use purposes include monitoring of program input processes and result, health system performance assessment, evaluating the result of health reform investment. Therefore, a health system framework WIHP framework, which is built on the 2007 WHO six building block framework. The framework is used to identify indicators of WHO building block and associated source of data, household data, facility surveys, routine health information system, vital statistic, and consensus. This is monitoring and evaluation, which include inputs and processes, include governance, financing, infrastructure, health workforce, supply chain information, it is indicator domain and data collection administrative sources. Output include intervention, assessment, service of readiness, intervention, quality and safety. Outcome coverage of intervention, prevalence, risk, behavior, and factors, and impact include improved health outcome and equity, social and financial risk protection, responsiveness, and efficiency. The data collection include population-based surveys, facility assessment, clinical reporting system, and civil registration. Analysis and synthesis include data quality assessment, estimate and projection, in-depth studies, assessment of progress and performance and efficiency of health system, and communication use include targeted and comprehensive reporting, regular review processes, and global reporting. Basic health system framework, which is actually the six building block, then the IHP framework 12. It is simple, linear, rather than things the way things really logic. Therefore, characteristics of all complex systems. Most systems include health system self-organizing, constantly changing, tightly linked, governed by feedback, non-linear, history-dependent, counterintuitive, and resistant to change. Therefore, some feedback loops exist. For example, at the level of supervisors, healthcare providers, and patient. Therefore, which can lead to satisfaction, acceptability of health, and sense of care. Therefore, we can recognize complexity in healthcare system and health system intervention of unpredictable paths of implementation. Health systems are dynamic and interconnected systems at whose people are at the heart, which are not addressed in the WHO Health 6 healthcare system model. And it is multiple relationship and interaction among building blocks that convert these blocks into a system. And it includes various level, meso level, which include organization and local level, then the micro level include individuals, citizen, patients, provider, health managers, policy entities, domestic health system. Global and international context include macro level. Another framework is also presented, WHO World Bank flagship program control norm framework, which is Robert et al. 2000 published a framework to assess health system performance. This approach was jointly developed by World Bank Institute and Harvard University School of Public Health and taught in the flagship program. It includes the focus of its frameworks to identify areas of policy action to modify health system and improve their performance. Its framework based on 5 control knobs that can adjust or change to strengthen health system. The control knob are discrete areas of health system structure and function include financing, payment, organization, regulation, behavior, which can be adjusted by various country actions. Its main function is to improve health system performance to ultimately achieve long-term positive health outcomes. One is financing knob, which deals with mechanism which mobilize money to fund healthcare and how it is allocated. Payment control knob looks at how provider are paid and incentive or disincentive creates to influence performance. Other control knob is organization, how healthcare delivery system are organized and managed. Regulation, these are the corrosive requirement imposed by the state. Behavior control knob is around influencing the behavior of providers and consumers to population-based intervention. These are grounded in social and cultural norms. These are the health system framework knobs, control knobs, financing, payment, organization, regulation, behavior knob. Intermediate performance measures include efficiency, quality, and assess and target population performance goal include improve the health status, customer satisfaction, and risk protection. The control knob framework of flagship framework include inclusion of behavior control knob, which include mix of behavior that influence both positively and negatively the health. Provider further evidence of health system analysis, acknowledgement of vigorous commitment to need for behavior change at all level of health system for continued growth and development. This is actually the Harvard flagship program reform and decision to reform health system dependent on combination of technical analysis, ethical analysis, and critical analysis. This is a comparison flagship program approach, which include five control knobs: efficiency, intermediate quality and assess, intermediate performance measures, and go performance goals, target public status, public satisfaction, risk protection. And WHO approach include health status, responsiveness, and fairness in financial protection, which are in coordination. Stakeholder perspective can vary according to health system, which can a profit-making system from perspective of private providers, a distribution system from perspective of pharmaceutical industry, employment system from perspective of health provider, market system, a health source system from perspective of client, social support system, complex system, a set of policy system, a set of subsystem from the Ministry of Health. Health policy and the health system. It include policy decision, for example, systems, hardware, human resources, finance, medicine, and technology, organizational structure. The policy decisions include systems, hardware, and system software, ideas and interest and redirectional and power. And it is also includes social and cultural context. System software, social and cultural context, which in and arena include at international, national, subnational, and local level. This includes system function. It is a complex system which includes system hardware and system software, and social construction is also in this policy context of health system framework. Social and political context include system software, hardware, human resources, finance, medicine, technologies, and system softwares include ideas and interest, relationship and power, values and norms, and social and political context. Understanding of organization include hardware is the organizational hierarchy, HR, establishment, technology, and finance. Tangible software include management, knowledge, and skills. Formal management processes. And intangible software include capability to commit and engage, adapt, self-renewal, balance, diversity, and coherence. Value, norms, informal rules, relationship, and communication. Therefore, all these conceptual frameworks provide the basis for understanding, investigating, and strengthening health system or facet of them, and so for working within and researching them. It is caveat to no easy answer how to improve health as a system. It includes politics and values matter. Therefore, that's an recent advances. The WHO agenda is given as organization, everybody business, strengthening the health system to improve health outcomes, WHO framework or action. It applies a diagonal approach to health system strengthening, which include taking the desired health outcomes as starting point for identifying health system and stop effective scaling up of services, addressing health system bottleneck in such a way that specific health outcomes are met, addressing primarily health system policy and capacity issues, encouraging the development of national health sector strategies and plan, robust monitoring and evaluation framework. Draft for discussion building on health system framework for developing common approach to health system strengthening is given by Gavi Global Fund and World Bank. According to this, an illustrative list of multiple health system framework is given. For example, Actor Framework, EVAN 1981, Fund Flow Payment Framework in 1991, Demand Supply Framework, Castles in 1995, Performance Framework, WHO 2000, control norm framework, reform public management framework, capacity framework, building growth framework given WHO 2007, essential public health framework, and systems framework. According to this draft, there is perspective, researcher and organization. There are types of prescriptive at sub system and national level, Romer's European Observatory, WHO regional sites, and analytical fund flow and functional. First OECD framework, NL and Williams Willis framework, Londano and Frank WHO 2000 framework. Statistical correlation include Nixon and Elman framework, Anand and Manning-Hossin framework. There is also deterministic and predictive models include actuarial model, Office of Actuary CMS, economic model, macro policy model. Dimension include overarching principle. According to this draft, better health, financial protection, responsiveness, and satisfaction. Overarching principle include intermediate objective and characteristic features, equity, efficiency, sustainability, quality, assess, coverage, safety, and choice. Processes control knob include resource creation, resource allocation, payment, organization, integration, regulation, and behavior. Building blocks of critical function include service, health workforce, health information, technologies and commodities, demand generation, financing, and governance. According to this where different interaction between health system framework is given. Multiple health system framework identifies synergies and converging element of multiple health system framework. Converged synergistic health system performance, identifying types of actions and strengths. Common conceptual framework of health system identified, assessing country needs, developing priorities, health system objective, developing intervention. Then come in national health system strengthening, developing work program, planning resources, assigning roles, and implementing health system strengthening policies and programs. Another article is published which is lesson from 20 years of capacity building from health system thinking. According to this, in 2016 flagship program for improving health system performance capacity, a partnership for leadership development between World Bank and Harvard, celebrate 20 years of achievements set up at a time when development assistance for health is growing exponential. The flagship program sought to bring system thinking to effort at health sector strengthening. Capacity building and knowledge transfer mechanism are relatively easy to begin. Yet the flagship program has continued for 2 decades and remains highly demanded for national government and development partners. It describes process and principle employed to create flagship program and highlights some lessons from 2 decades and sustained success and effectiveness in leadership development for health system improvement. Another framework, strengthening health system to improve maternal, neonatal, and child health outcome. A framework. In this, it uses a control no framework system enabling environmental governance, leadership, oversight, policies and regulation, financing, provider payment, service delivery include infrastructure, health workforce, information, medical, product, vaccine and technologies, household characteristics, size and composition, health and education, inter household power relation, individual factor, biological factor, psychological, behavioral factor, community, social environment, physical environment. It all interact with maternal and childhood intervention. This include household system coverage and quality of MCH intervention and impact of maternal, neonatal, and child mortality or morbidity. This include external shocks, and they use the health WHO framework control no framework to improve the maternal and child health morbidity and mortality. Health system strengthening a literature review. According to this, the framework describe on health system inform the monitoring and valuation of health system programs and projects. They are not designed for the purpose. These are intervention include introduction of government sponsored health insurance, community based health insurance, performance based financing. Given the vastness of health system framework and strengthening and exhaustive literature, such a framework and monitoring evaluation can carry it out, and it can give illustrative example. These are identified health insurance could in 2001 integration, decentralization framework, contracting framework, hospital autonomy framework, routine health information system framework. Inclusion, the such use approaches that can be divided into main tools and guidance to conduct monitoring and evaluation. In general, guidance on monitoring and evaluation is extensive. This review narrow the choices and make the task faster. Beyond the building block, integrating community roles in health system framework to achieve health for all. This system achieving ambitious health, the every woman child strategy. According to this paper, suggests that expansion of WHO building block starting with the recognition of essential determinants and production of health. It provides expanded framework that articulate the need for dedicated human resources. It includes information, learning, and accountability, cognizes societal partnership, critical link to public health sector. This framework explicit the often neglected investment need for community health and aims to inform efforts to situate community health within national health system. Health system framework in their political context. In the political context, the evolution of thinking over time does not reflect a progressive accumulation of insight. Instead of theories and frameworks seem to develop and relation to one another. These health system theories and framework from health system and policies in particular political and context paradigm. While there is clear trend to try to understand the complexity and dynamic relationship between elements of health system, there is demand to provide framework that distinguish between health system intervention along mapping of analysis of their return. According to this paper, health system goals are discrete trial experiment to obtain societal valuation. It is a literature view on health system performance and various comparative performance assessment. It identified 5 health system goals, all 5 significantly affected choice behavior. An equitable distribution has obtained the highest weight, followed by average level of health, financial fairness. Both process outcome derived from process and distribution receive much lower weight. Conclusion, framework adds value to adds value to the WHO. We demonstrated the feasibility of merging societal valuation of health system goals with multi-attribute technique based on trade-off. Weights place much greater emphasis on health and health inequality than one process output. This study improves the methodology of international health system performance comparison and thereby enhance global evidence-based health policy information. MCQs. MCQs 1. There is substantial diversity in health outcomes between developing countries with similar income and educational level. The health utility is one of three health system interdependent outcome oriented objectives, which is the goal of health utility. Alpha distribution of health according to allocative efficiency, beta distribution of health according to quality, C distribution of health according to equity, D distributional fairness of process, E financial risk protection. C will be the correct option as health utility is one of the objective of health system function and health utility is based on the principle of equity and average level of health. Therefore, C will be the correct option. MCQs 2. A cholecystectomy patient and hospital waiting list were surveyed about the willingness to pay for laparoscopic rather than conventional cholecystectomy by a group of public health students. The survey is concerned with the concept of dash in healthcare. Alpha achieving average level of health, B equitable distribution of health, C financial risk protection, D process utility, E time utility. What will be the concept of healthcare in this scenario? Delta will be the correct option. Process utility in this scenario, there is willingness to pay approach is used for uh, surveying the cholecystectomy patient, and process utility is actually used the process willingness to pay approach method. Therefore, delta will be the correct option. Process utility. MCQ 3. Health spending would be increased from 5 to 10% of government budget in 2017 according to XYZ country declaration TB and other health related infectious disease which was signed by country leader from XYZ in 2017. It serves as an illustration of which component of healthcare system. Alpha leadership, beta health information system, health financing, health workforce, medical product or technologies. C will be the correct option, health financing, as it increase allocation of budgets. So C will be the correct option. MCQs 4. An XYZ country has increased the burden of maternal deaths in basic health unit from last 10 years. Healthcare delivery of XYZ country covers the entire range of promotion, preventive care, rehabilitation, and palliative care services that are not integrated into a single network. The major cause of these increased maternal death is cultural barrier, B. Fragmentation of healthcare, C. High cost of health services, B. Inequality, E. Poor quality of health services. What will be the correct option? Beta fragmentation of healthcare. Because as in this scenario, there is all services present, but they are not into single network. Therefore, beta will be the correct option, fragmentation of health services. MCQs 5. In 2020, ABC government launched a 5-year program to train medical officer to perform surgical procedure in places where consultant when unavailable. These include pregnancy-related problem, trauma-related complication, and acute inflammatory disorders. It is an illustration of which health system? Leadership and governance, health information system, health workforce, health financing, and medical product or technologies. Delta will be correct option, health workforce. Competent health workforce is created in this scenario, therefore delta will be correct option. MCQ 6. A model of care in developing country is health workforce that will be delivered to fulfill the ABC country population health requirement, desires, and expectation. Which of the following model will be required for delivering health service in response to ABC population health requirement desires? Alpha Babbage model, Bismarck model, National Health Insurance Organizational model, E out-of-pocket model. Delta will be the correct optional organizational model, which include the delivery for service according to population health requirement. MCQ 7. Surveys showed that one of the Pakistan's most problematic area is healthcare. Improvement have been slower than in comparable countries. The primary healthcare delivery challenge is the alpha cultural barriers to health accessibility, beta fragmentation of healthcare delivery, high health cost, inequality of poor quality of health services. What will be the correct option?
B.
Beta will be the correct option as in developing country there's fragmentation of healthcare delivery system in coming in years. MCQs 8. International Health Partnership has developed a uniform monitoring and evaluation framework of health system. This framework is both country specific and global in framework. The framework additive value is that it is a tool that gathers health indicator and data from several sources. A tool that addresses fragmentation of health services, tool that consider the horizontal health management, a tool that addresses a cultural barrier to health accessibility. Alpha will be the correct option. It is a tool that health indicators gathers health indicators and data from several resources to get a result. Therefore, IHP framework actually gather the health indicators and data. MCQs 9. Globally, tremendous success has been made in delivering intervention to improve mother and child health and reduce HIV, AIDS, TB, and malaria mortality and morbidity. The WHO Six Pillars framework contributes to strengthening of health system in various ways, but the major weakness of WHO Six building block is absence of health financing component, absence of health workforce component, absence of leadership or governance partnership, consideration of horizontal health management, or lack of substantial and dynamic interaction between six building blocks. E will be the correct option as all the component is present, the health financing, workforce, leadership, governance, management of health management. There is major weakness is that there is lack of substantial and dynamic leadership, interaction between six building blocks. And in response of this, the IHP framework is developed, which include input, process, output, or impact framework based on the six building block element. Because the major weakness in this framework is that there is lack of substantial and dynamic interaction between six building blocks. This is a major weakness. E is the correct option. MCQs 10. Dr. Akbar, a student of PhD Public Health, want to research the response of health system failure on HIV/AIDS by studying the social risk factor and behavior of health consumer and provider in XYZ country city. To explore how and why government can do better, which health system framework he will be used. Biomedical model, Bismarck model, flagship framework, organizational model, or revised WHO health system performance framework. C will be the correct
C.
option. Is the flagship model which include the control node. This is the key of my MCQs and thank you.
Thank you very much, Dr. Khansa. Very nice presentation, and especially the part on models of different healthcare systems and the WHO gaps. What are the pillars and how they fail to interconnect, and that has led to the important type of system errors that have been generated over many years. So this is a very good presentation, and the highlights of this presentation are the weaknesses and gaps that you have correctly identified. I hope this exercise will continue